Hello, everyone. Today we'll be presenting our study titled Examining the Role of Student Health Insurance Plans in Healthcare Utilization Among College Students. My name is Natalie, and today I'm joined by Asha, Ryan, Emma, and Doy.
I will start with a background. Most U.S. college students have some type of health insurance, mainly because of the Affordable Care Act and college rules. At the University of California, all students are required to have health insurance. UC SHIP is a student health plan that covers campus service and partner providers. Students who already have a similar coverage can opt out by submitting a UC SHIP waiver.
Our literature review showed that prior studies did not really examine the implication of student health insurance plans and how this might affect how students access healthcare. In general, the literature did show that college students demonstrate poor health insurance literacy and low self-efficacy, meaning they have little confidence in understanding how to navigate the health insurance system. There was an interesting parallel between students and Medicaid. So Medicaid has very strong geographical limitations as it is state specific. This means that you would have to pay a lot out of pocket in order to access care that is in a different state. And this is shown in one study where Medicaid patients live near state borders were less likely to cross borders in order to access care that on paper might be closer and easier to access. And so these patients saw lower utilization care and more delayed care. Students also have these geographical boundaries, although less institutionally defined. Students ideally would access care that is on campus or very close to campus. However, this might not match their insurance realities. For example, students without SHIP have to pay high prices in order to see campus providers compared to those with SHIP.
So in our study, we aim to examine how different types of health insurance coverage among college students impacts their ability to access healthcare and their actual usage of their health services. Specifically, we focus on comparing students covered under the UC Student Health Insurance Plan, or SHIP, with those who either waived SHIP or were uninsured. Our objective was to explore whether insurance coverage type influences both healthcare utilization and accessibility, particularly because SHIP is directly linked to student health centers, offering conveniences and possibly lower out-of-pocket costs. Our hypothesis was that students enrolled in SHIP would report higher rates of healthcare utilization due to greater proximity to covered providers, lower financial burden, and familiarity with the system on campus. On the other hand, those without SHIP might face more logistical or financial barriers, resulting in lower usage despite possibly needing care. This research is important because most U.S. college students are required to have insurance, yet few studies actually look at how the specific plan they have actually affects their experience navigating their care. Our findings can help institutions better tailor health policy decisions and outreach efforts for their student populations. For our methods, we recruited undergraduate students at UCLA who were 18 years or older. They completed an anonymous online survey during winter and spring of 2025, and we used a convenience sampling approach, meaning participants volunteered through campus outreach and weren't randomly selected. We did things such as going out to clubs and classrooms and passing out flyers. Participants were asked to indicate whether they had health insurance and if so, what type it was. Specifically, whether they were insured through SHIP or had it waived for private insurance or another plan. For our study, we conducted descriptive statistics to summarize the sample, followed by chi-squared tests to compare categorical values like utilization rates. Finally, we ran independent samples t-tests to compare means between SHIP and non-SHIP groups on variables like health literacy and delays in care. These methods allowed us to test our core hypotheses while also examining subgroup differences in a straightforward yet well-rounded way. This survey was designed to be multifaceted, capturing not just whether students were insured, but also how confident and capable they felt navigating their healthcare system. One major part of the survey measured healthcare utilization and delayed care over the past academic year. So this included questions about whether participants saw a doctor when needed, delayed care due to cost or confusion, or used emergency services. These questions were adapted from the NIH's All of Us Research Program survey, ensuring strong validity and consistency with national health research. We also use the Health Insurance Literacy Measure, or HILM, which is a validated tool assessing four key dimensions. One, confidence in choosing a plan. Two, behavior when selecting a plan. Three, confidence in using the plan. And four, behavior when actually using the plan. We made a critical adjustment for first year and first year transfer students who may not have had yet the full engagement with the UCLA health system. So these students received a modified survey reflecting their shorter time on campus and potentially limited experience seeking care.
So for our study, we surveyed 217 UCLA undergraduate students, composed of 62 first-year students and first-year transfers and 155 non-first-year students. And around 34.1% of the students have some form of UC ship, and the breakdown is relatively similar between the groups. If you look at the chart on the right, you can see that, like I mentioned before, around a third of the students have some form of UC ship, and in both the students with experience navigating UC healthcare and all UCLA undergraduate students, within both populations, the majority don't have access to the Asha Student Health Center, and the majority are also local, meaning that their house is located within 50 miles of UCLA.
Now we're going to move on to results. So interestingly, when we examined actual healthcare utilization, there was no significant difference between insurance groups for specific services like primary care or dental visits. However, Fisher's exact test revealed that SHIP students were significantly more likely to have forgone all healthcare in the past year compared to their non-SHIP counterparts. This difference was statistically significant with a p-value below 0.001, which points to a broader access or engagement issue despite having insurance coverage. Next, we analyzed health insurance literacy among SHIP and non-SHIP students. So our analysis used independent t-tests and showed that students on average scored lower on the health insurance literacy measure than national averages. And additionally, within our sample, SHIP students consistently scored lower than students with external insurance across all 4 HILM categories. Although all p-values were below 0.1, the difference in behavior choosing a health plan subscore was statistically significant with a p-value less than 0.01, highlighting a meaningful gap in plan selection, confidence, and behavior among UC SHIP students. This box plot visually supports our earlier findings. We do see that UC SHIP students shown in yellow generally score lower than their externally insured peers in blue across all 4 categories. Again, these visuals highlight the statistically significant difference in behavior choosing a health plan subscore.
So again, we found that those with UC SHIP were more likely to have foregone any healthcare within the past academic year than those without UC SHIP. And so this actually did not support our hypothesis. We actually predicted the opposite. So those with UC SHIP would be more likely to access healthcare utilization. One part that might help explain why this did not support our hypothesis were the underlying differences in health insurance literacy. So those with UC SHIP compared to their non-UC SHIP counterparts again scored lower in health insurance literacy, and so this might explain lower confidence in actually utilizing care, and then translating into lower utilization of care. And overall, our study did replicate prior studies that demonstrate that college students generally have low health insurance literacy and self-efficacy.
Recommendations, we suggest using better ways to select participants in future research, like stratified or cluster sampling, instead of just picking whoever easiest to reach. Because UC SHIP is offered across all UC campuses, it gives us a great chance to include students from different schools and studies. We also recommend using stronger methods to understand how students actually use their healthcare. The big takeaway here is that just having health insurance isn't enough to make sure students get the care they need. We need to help students understand how their insurance works and how to navigate the healthcare system. Finally, we want to thank Bruin Public Health, especially Nick and Elise, for all their guidance on this project. We also thank our faculty mentor, Dr. Eisenberg, for his expertise and the UCLA Samuel Healthy Campus Initiative for funding support. And this is our reference, and thank you for listening.